Hello, it's Dr. Joe, aka Cancer Talk, and I'm here today to talk to you all about the need for new creative approaches to curing and treating cancer. Currently, there are three major ways to treat cancer. One is resection or surgical removal. Two is the poisoning of highly proliferative cells. And three are immune mediated techniques that target pro-oncogenic proteins and or pathways. Resection of a tumor or the surgical removal of a tumor can be curative if the tumor is caught early enough. Unfortunately, many times cancer patients enter the clinic to be treated after the cancer has spread when it has created side effects or symptoms. Once the primary tumor has spread, surgical removal is rarely curative. Now, there's been great advancements in how to use surgery to treat cancer in a way that maintains the quality of life of cancer patients. But surgery alone, once a primary tumor has spread from its initial encapsulated state, and also for leukemias and other forms of brain tumors, will never be the be all for treating or curing cancer. Poisoning highly proliferative cells within the body of a cancer patient is another very commonly used technique, usually through either chemotherapy or radiotherapy. Chemotherapy and radiotherapy, both in combination with surgery and also in combination with other therapies, can be very effective, but the efficacy of introducing something that will kill any cell in the body and just preferentially kill highly proliferative cells is obviously not perfect and leads to great sickness in patients, and unfortunately cannot cure all cancers. In fact, it treats many, but few cancers are completely cured with chemo or radiotherapy all alone. The newest in the three major types of treatments that I am talking about, which is specifically the immune mediated targeting of pro-oncogenic proteins and pathways, either through humanized antibodies, through things called cancer vaccines, or through or using immune modulators that prevent cancer cells from hiding from the patient's immune system, are new and exciting, and they have shown great promise, but they haven't shown the ability to be curative in a wide range of cancer states quite yet. That may change in the future with continued research, but right now, these immune-mediated techniques are not leading to cures per se. I think it's important to note here that there are a couple other strategies that also work well that are used often in the clinic. One specifically would be the inhibition of tumor angiogenesis. The problem with that technique is that the primary driver of angiogenesis, or the creation of new blood vessels in our body, is a growth factor that's expressed so widely and so often that inhibiting that growth factor causes this very difficult off-target effects that can be almost as dangerous to the patient as the cancer itself. I am calling on my fellow researchers and the funding agencies that allow us to do our work to start to push for much more creative and completely new ways of approaching cancer treatment. Few things have remained the same in our society over the past 20 plus years. And yes, there have been incremental improvements in resection, and is improved greatly. For example, clinician of those who treat cancer are learning how to take out the least amount of tissue to get the best clinical result, which has done great things for people's quality of life. Um, as far as the chemo and radiotherapy, um, there have been combinations and different treatment schedules that reduce the amount of these poisons that the patient has to take, and still getting good results as far as extending life, and hopefully in more and more improvement of quality of life while living. Um, and again, I'll repeat, as far as the immune mediated cancer treatments, there are definitely a lot of work to be done there, and there is a lot of promise, but there's a lot more research that needs to be done in that field in order to see what is the limit, what can those techniques do for us and do for patients and do for patients. Targeting tumor neoangiogenesis, I believe, has a lot of promise. The problem is that VEGF, or vascular endothelial growth factor, is too widely expressed in our bodies, both in healthful situations as well as cancer. So blocking all of the VEGF in a patient's body just to try to treat the cancer creates an untenable balance between the health of the rest of the patient and the destruction of their cancer. I believe if a new technology that could keep the VEGF inhibitor directly in the space of the cancer, then that will make that technique much more viable and potentially curative. Uh, but without another invention, I don't believe that targeting VEGF in the body of a patient is going to be the route to curing cancer. So in closing, I encourage everyone watching this video to please leave their ideas in the comment section about what new creative ways, or what new pathways or unique properties of cancer cells can be targeted to lead to the next generation cure for cancer. Um, Again, I don't think the three major techniques, except for maybe some new immune mediated treatment that has not entered the mainstream yet, I don't believe any of these three will lead to the curing of new cancers. Uh, please, again, I said, please leave in the comment section any new or creative ideas, and who knows, maybe the conversation will start right here. This is Cancer Talk. Stay well and look out for each other. See you next time.